Hi, it's a great day to talk rehab. I'm Dr. Donald DeFabio, and we're continuing to talk about the squat. Today, we're going to be talking about the lower domain of your body and the squat. This is the junction box between your upper and lower body, and there are some things that can occur at this level that really make you at risk for injury and turn a very functional and important exercise into something that ends up sending you here as a patient. And that's what all my videos are about, by the way. They're about empowering you with information to stay healthy and to stay well and to reinforce all the treatments we do in the office. And there's nothing wrong with getting treatments in the office, but people want to be independent as well, so that's what this is about. So, let's talk about that. Mike, I'm going to need the blue stability discs for this today. Okay, if you get those and bring them over for me. Let's start off with a quick review of the squat. So I'll hold on to these for a second. I get to say hi.
Hello.
There he is, the guy. So remember, feet shoulder width apart, feet straight ahead, knees. Now we're going to watch the knees. Make sure they track over the feet. Hips are level. A good solid hip hinge. Stiffness in through the torso. Okay. Neutral spine. No arching, no rounding. All right. So prisoner position. Yeah, let's go sideways. Okay. And let's review the regular squat. That's what we want to see. Good hip hinge. Keeping that neutral spine. Go ahead again. I got it. Just go ahead. And then those 3 points of contact, butt, thoracic spine, and head. Come on up. So one of the most important things that we have to watch out for, forward lean. Show me a forward lean, all right? Mike's going to give me a good stiff spine, but watch what happens. He's really bent forward. Now you're going to say, but it's a stiff spine, it's a flat spine. But he's lost his torso shin angle. You want to go as deep as you can. Our goal is to get to 90 degrees, but you need to maintain a rigid spine with a parallel torso shin angle. Show me half squat, about 45 degrees, but a good torso shin angle. All right, stop. So the angle of his torso right here is parallel to the angle of his shins. Now go a little deeper. Now Mike can go to 90 degrees and maintain that parallel shin torso line, which is what we want. Come on up. Go only halfway, but show me falling forward. Not good. The torso line's here, the shin line is here, they're not parallel, okay? They need to be parallel. Come on up. So that's falling forward. We really need to avoid that. That's dominance of the hip flexors. Let's face front. The next thing we like to see, prisoner position, or we don't like to see, but we commonly see, is a lateral shift, or we call it a booty. So you want to have a right or left booty, Mike?
We'll go left.
Okay, so he's going to squat. Go ahead. And he's scooting off to the left, all right? Now that could be from a lot of things. It could be from an ankle issue, a knee issue, a hip issue, or it could just be he doesn't know how to squat properly, all right? So you always start off with verbal cueing to fix these. But go ahead, squat again. And that's going to tell me there's going to be muscular weakness in the glute med on this side, probably muscular tightness on the glute med on the other. Piriformis is also going to be tight over here. Adductors on this side are going to be involved as well. So they want to keep the hips level. Going down at the knees need to track. Let's show me a good squat. Over the toes. Knees over the toes, knees over the toes. Come on up, turn towards me. The shin line, go ahead, knees over the toes. The knees go forward a little bit, past the toes, but they're not excessively past the toes. But what's important, that's what go ahead, show people that. We don't want that, but what's really important is maintaining that tibia shin line. That's the key, okay? Let's go forward. So, good tracking is important, but what's the bad thing? Let's go knees in, okay? You get what's called the valgus deformity squat, and your knees start to collapse. Now, one knee can collapse, both knees can collapse. That's going to create a lot of tension, not only in the knee, but on the patella. So oftentimes the problem with that could just be as simple as a poor hip hinge. So quad dominance and weakness in the hamstrings. The knees can also go out, right? So let's show us a knee out variation. And the knees go out. One knee can go out, both can go out, but the bottom line is they're not tracking over the feet. Remember, we want to keep you at shoulder width apart for the feet because that's where you're going to get the least amount of irritation to the knee biomechanically, research has shown. If you go really wide or really narrow, it's not going to be as beneficial in keeping your knees healthy. Moving down to the feet, we have to watch the feet. So they can, one can flatten, one arch can flatten or collapse, okay? So let's do that first, all right? So one arch can roll in or flatten. It's a little tough to see with the shoes, but you'll get that type of thing. What happens a lot is the calves are tight, and when you squat, the heels start to roll up. Bad news, okay? Do it again, and the heels start to roll up. You know, might have really good shin line to torso, might not be falling forward. Everything else is great, but if those heels are coming up, that's not a good sign. That tells you there's a problem in through the calves. If you can't keep your feet well rooted while you're squatting, in fact, the weight should go to the heels, shouldn't it? When you do that hip hinge, you should probably get a little bit more weight on your heels.
Yeah,
correct?
I usually say about 2/3 back of the foot.
That's where you want to get it. See, and what happens, you can hold that for a second, Mike, because take a look at my squat for a second, all right? So if I come up in through here, I can go back to here before I get jammed up, right? I go back here until I get jammed up, all right? Now I'm going to take something, a little stability disc, and I'm going to elevate my heels about 2 inches, okay? This is impacting the mechanics of my foot and ankle and lower leg. Look at the difference. Amazing, isn't it? Right? I know I have an old ankle injury, it's that old snowboarding injury. But seriously, my left ankle doesn't have as much function as the right, therefore it impacts my squat. So you need to make sure that your squat mechanics are good, and that the reason your squat mechanics may not be where they need to be is more than just skill, that you don't know how to do it. Learn how to squat properly, look at the upper domain, look at the lower domain. If you learn proper squat mechanics and you still can't squat properly, like me, until I get my heels elevated, or until I do another corrective procedure, or if I can't do it at all, then you got to get into the office and get some treatment and get whatever the problem is fixed. My job is to find those problems, and we're going to be talking about the differential diagnosis of different body parts as we move forward with our squat videos. So that's the lower body squat. Do we miss anything?
I don't think so.
Well, thanks for tuning in. I'll take the dowel, and I'm going to do a few back squats with my heels elevated, just so you guys can be... See you later, Mike. I'm just going to keep working out, okay? So you guys can be well empowered to go home and get some good squat mechanics, all right? I'm Dr. Donald DeFabio. Thank you very much for your time today. Thanks for tuning in. And if you have any questions, shoot them out. I'll get back to you. Have a great day.